Good afternoon, everyone. This is Shireen Risk, CIFAL York's Operations Manager. And on behalf of the organizing team, I would like to welcome you and thank you all for your participation in the second session of the Transportation Equity and Justice Speaker Series. And before we get started, as always, we will start with an acknowledgement of the land. As we are all not gathered in the same space, we recognize that this land acknowledgement might not be for the territory that you are currently on. We ask, if this is the case, you take the responsibility to acknowledge the traditional territory you are on and the current treaty holders. We recognize that many indigenous nations have long-standing relationships with the territories upon which York University campuses are located that precede the establishment of York University. York University acknowledges its presence on the traditional territory of many indigenous nations. The area known as Takarantu has been caretaken by the Anishinaabe Nation, the Haudenosaunee Confederacy, the Huron-Wendat, and the Métis. It is now home to many indigenous peoples. We acknowledge the current treaty holders, the Mississaugas of the Credit First Nations. This territory is subject of the Dish with One Spoon Wampum Belt Covenant, an agreement to peaceably share and care for the Great Lakes region. I will now hand it over to Professor Ali Asghari, the Director of CIFAL York, for introductions and to start off the sessions.
Thank you very much, Shirin, for the introduction. I would like to open this session. Dear distinguished speakers, moderator, and participants. Welcome to the second session of Transportation Equity and Justice Speaker Series, organized by CIFAL York in collaboration with York Region, the City Institute from York University, and UNITA. I would like to use this opportunity to thank all the speakers, especially the speakers for this session, and moderator for accepting our invitation, as well as our collaborators. It could not be done without your support, help, and presence. The fact that our registration has increased, doubled basically from the first session to this session reflects the importance, the need, and the interest of the community, professional community, academic community, and practitioners to this topic. CIFAL York welcomes partnership in knowledge sharing and training in this area. I now would like to welcome Ms. Tia Cumming from York Region Public Health, Community Health and Service Department for her welcome note. Tia, floor is yours.
Good morning, everyone. Welcome to the session, and just wanted to mention that York Region Public Health values this partnership within CIFAL York. And we collectively recognize, of course, the importance of bringing the experts to you to build capacity in our communities through this speaker series. As a public health nurse myself in the area of built environment, my work encompasses striving to improve community health and well-being, preventing transportation-related injuries, and reducing health inequities in our communities. So this Transportation Equity and Justice series provides a space for sharing experience, knowledge, and discussing how equity, justice issues and considerations are addressed in transportation. So on behalf of CIFAL York, we hope you enjoy the session, and we invite you to engage during the Q&A to continue the conversation. Thank you, and a warm welcome to all our speakers today.
Thank you very much, Tia, and thank you to York. Thank you on behalf of us to York Region for supporting this event. Now, and without further ado, I would like to warmly welcome and introduce our York University colleague and moderator for this session, Professor Patricia Wood. Dr. Wood is Professor and Graduate Program Director of Geography, as well as co-founder of the City Institute at York University. She studies rights, right claims, activism, and governance, particularly the experiences of marginalized communities. Her current projects include comparative international research on municipal and urban regional governance. And she is a member of the research team for the Student Move 2, which will be coming next session, a multi-stakeholder project on post-secondary student transition practices in GTA. She has written a transit and urban affairs column for several years, first with Toronto East, and now for spacing.ca. She is a senior advisor for the transit advocacy organization called Code Red TO, and was also a member of the City of Toronto TTC Transit Review Expert Advisory Panel on the proposed upload of the subway. Patricia, it's a great pleasure to have you here, and the floor is yours. Thank you very much.
Thanks very much, and welcome everyone. This is a really wonderful series. I'm very honored to be participating in this round. I'd like to introduce our first speaker today, who is Todd Litman, joining us from the West Coast. Todd Litman is founder and executive director of the Victoria Transport Policy Institute, an independent research organization dedicated to developing innovative solutions to transport problems. His work helps expand the range of impacts and options considered in transportation decision-making, improve evaluation methods, and make specialized technical concepts accessible to a larger audience. His research is used worldwide in transportation planning and policy analysis. I happen to know he has a book that came out, I think, just last year. And I also know that in his work, he has a deep commitment to issues of equity on several fronts. Very warm welcome. Thank you for getting up a bit early. Over to you.
So, greetings, everybody, from Victoria, British Columbia. It's a great pleasure to be able to participate in this. As some of you might know, I've done a lot of research looking at how transportation and urban planning can help achieve social equity and public health goals. And so I'm going to talk about some of the results of my research and the recommendations that come out of it. I hope that this is useful, that this is the level of interest. And I hope that there'll be plenty of time for questions and discussion, so we can really hone in on the issues that you're dealing with. So let's start with an understanding of why it's really important for transportation and land use planning decisions to take into account equity and health. And you can think of the many ways that, for example, transportation planning decisions affect our lives. Most people spend more than an hour a day traveling outside their home. So it's a major part of just our daily experience. If you have a nice trip, if your travel experience is nice, say a nice walk or bike ride or comfortable trip on a bus or a train or a nice drive, that can be the high point of your day. But if it's a lousy experience, if you're stuck on a crowded bus or train, or you feel unsafe when you're walking on the street, that can be the low point of your day. Transportation directly and indirectly affects our household budget. Average households spend about 20% of their budget on transportation and residential parking for their vehicles, and it's regressive. Lower income households tend to spend more of their budget on transportation than higher income households. So affordability, the ability to get by with minimum transportation expenses, has a huge impact on people's ability to afford basic goods. When people complain that they can't afford healthcare, or they can't afford to go back to university, or they can't afford healthy food, the real reason is often excessive housing and transportation costs. And transportation is especially insidious because some of the costs are large and unpredictable. If you're automobile dependent and your car breaks down, that is a financial crisis. Transportation planning decisions also directly affect our health. They affect our exposure to accidents, traffic accidents, and they affect the amount of exercise we engage in, and they affect our exposure to air pollution and other types of pollution. They also affect our interactions with our neighbors, what we technically call community cohesion. Pretty much the more opportunities people have to walk around their neighborhoods, the more chance they have of getting to know their neighbors. If you want to maximize community cohesion, I recommend you get a cute dog, because there's nothing like walking around your neighborhood with a friendly dog to make friends. Transportation planning decisions and the accessibility that people have to services and jobs also affects our opportunities in life. And there's good research showing that the children born in lower income households are more economically successful if they live in a high access neighborhood where it's easy to get services and particularly to access jobs from their home. And then, of course, transportation planning decisions affect many external costs. They affect how we impact our neighbors. So all of these have social equity impacts. So there's a broad range of social equity impacts to consider. And in my research, I've developed a sort of categories to be able to think and talk about these impacts. So I divide social equity impacts into horizontal equity, and that assumes that people are more or less similar in need and ability. And so we're asking, are people getting their fair share of the common public resources? Vertical equity takes into account situations where people are different in their needs and ability. And it basically says that policies should favor the disadvantaged groups. And within that, there are a number of subcategories, and I'll go into a little bit of detail, but not nearly as much detail, not too much detail. I don't want to get too involved in any of these points. But what I do think is that this is one of the important emerging issues. So transportation planning or planning in general often experience an emerging issue. And if you're smart and ambitious and want to do good in the world, you become an expert in one of the emerging issues, because there's a vacuum to be filled. And I think practical application of equity analysis to transportation and community planning is an important emerging issue. So let's proceed, and I'll briefly touch on some of these transportation equity issues, and then I'll discuss some applications, some ways that we can apply that. So one of the first questions to ask in equity analysis is, are people getting their fair share? So one way to break it down is between motorists and non-motorists, or you could say by mode. Certainly, if somebody relies entirely on automobile transportation, it kind of makes sense that they would say, oh, I want my share of the public resources to be devoted to roads and parking for my own use. Although even then they might want better alternatives. They might want to support better walking, bicycling, and public transit so that their neighbors will drive less and impose less traffic congestion. And so their family members can get around without needing to be chauffeured. But the basic question, that you could call it my fair share. That's the discussion is, are we allocating a fair share of public resources to people, to each person? And in a typical community, somewhere between 20 and 40% of residents cannot or should not or prefer not to drive to most destinations. That includes people with disabilities and low incomes and adolescents and families where there's one car that's shared by multiple adults. It can also be when somebody goes out socializing and they're doing some drinking. And the question is, can I safely get home without having to drive? And tourists and visitors, people who temporarily lack a vehicle, and people who just enjoy walking and bicycling or taking their dog out for a walk. Those are all legitimate uses of our public roads and public facilities. And my research suggests that non-drivers get far less than their fair share. If you look at how governments are allocating transportation dollars, and especially if you take into account parking subsidies, most governments, most local governments, they mandate that every developer has to provide expensive parking. So they're forcing people who don't own a car to subsidize the parking spaces of their neighbors who do own cars. It's a huge economic cost that's often overlooked in this kind of analysis. And so my analysis suggests that a typical community is devoting about 1% of its transportation resources to walking, and about 1% to bicycling, and maybe 5 to 10% to public transit, and something like 90% to automobile travel. And you can ask, does that represent, is that a fair share? And I would argue no, that we are under-investing in the modes that are used in the non-auto modes. There's another way to look at it, another component of this, and that's to ask which modes impose greater external costs. That is, they get their infrastructure is subsidized. They impose crash risk on users, other road users. They impose congestion delay because they take up more road space. They impose delay to pedestrians. So the degree that vehicle traffic imposes delay to pedestrians, we call that barrier effect, and pollution. And there are various ways to put dollar values on these and to take these into account. If you measure them per unit of travel, the differences aren't that great. But motorists, people who rely on automobile travel, they travel far more annual miles or kilometers than people who rely on walking, bicycling, and public transit. And so when you look at the impacts per capita, people who drive less than average are greatly subsidizing or bearing external costs of people who drive more than average. And I would argue that's a great inequity that is not generally considered. Another category of equity analysis is affordability. To what degree are we ensuring that somebody with a low income who wants to save money, wants to avoid being burdened by transportation costs, have those options? And you can look at, I can report from personal experience. Our family has not owned a car for a decade. We rely on walking and bicycling and public transit, and we spend very little money on local transportation. A typical car owner spends at least $4,000 or $5,000 a year on their vehicle. And if they're high mileage, if they live in an automobile dependent suburban location where they have to drive a lot of kilometers every year, they are probably spending $6,000 to $10,000 a year on transportation. So creating a community where it's easy to get around without driving delivers a huge benefit to moderate and low income households. There are a number of tools available for analyzing this. Unfortunately, most are US based, not Canadian based. But there are ways that we can look at what it costs the average household to own and operate their vehicles. This is one of those mapping systems. It's called the Housing and Transportation Affordability Index. And it generates heat maps of various locations indicating the average household expenditure on transportation or on transportation and housing. And consistently what it shows is that the most affordable places are the neighborhoods that have good walking and bicycling and public transit and good access to local services. So I happen to use Nashville in this map. The central neighborhoods have the lighter color. The more automobile dependent sprawled areas have much higher transportation and housing costs. There's some specific examples of the huge inequity that can result from well-intended planners who failed to take into account all the equity analysis. For example, for much of the last half century, it was common in cities to destroy some of the most compact, walkable, essentially affordable neighborhoods, the inner city neighborhoods, for the sake of building freeways or highways. We destroyed high access, low cost neighborhoods to allow suburban motorists better access to jobs in the city. And this made sense if you value mobility. That is, you put a high dollar value on being able to drive faster, and you ignore the social equity impacts of destroying urban neighborhoods, well-established urban neighborhoods. So there's a great need to critically analyze the assumptions and methods that go into our transportation planning and our land use planning, our community development planning, with an eye toward affordability and related goals like health. This can get really complicated and difficult, however, because there are so many facets of social equity. And so in order to simplify things, I recommend defining practical objectives, things that are measurable and achievable, that you can say, this is how we're going to try and achieve our equity goals. So for example, a community could decide that they're going to have objectives that everybody should contribute and receive comparable shares of public resources, people of similar abilities and needs. And the transportation system should serve non-drivers at least as well as it serves drivers, and affected people should be involved in the planning. It also suggests that we should minimize those external costs that one traveler imposes on other people, and that means favoring the resource-efficient modes, modes like walking and bicycling and public transit, over the resource-intensive modes that tend to impose larger external costs like congestion and risk and pollution. That we should ensure that we accommodate people with disabilities and other special needs, what we call universal design, and that we should plan to achieve basic accessibility so everybody can access the essentials of life. We should favor affordable modes, and in some situations provide discounts for lower income users, and ensure that there's plenty of affordable housing in the accessible neighborhoods, and that we have targeted actions to address social justice goals. So there's also a whole set of these objectives that you can apply to health goals. So you can identify various ways that transportation planning decisions affect our health, community health, and you can identify ways to some health strategies. So, for example, reducing crash risk. Traffic casualties are a major cause of injury and death, especially to younger people. We can have targets that we encourage physical activity. We favor the physically active modes. We reduce air pollution exposure, so we reduce the amount of emissions that transportation emits. We address affordability, because that's a health. Being able to afford healthy food and healthcare is a health issue, and access to healthcare. So there are specific ways that we can design our communities and plan our transportation system to help achieve health goals. Let me just show you a few of some of the research I'm engaged in. I've worked on. One is looking at the factors that affect traffic fatality rates in a community. This graph shows traffic fatality rates, the death rate per 100,000 population relative to transit ridership in various US urban regions. And what it shows is the urban regions that are more transit oriented have much lower traffic fatality rates, not just a little bit lower, but much lower average death rates than the cities that are automobile dependent. and that applies both to total and particularly to youth, indicating that many people would like to reduce their risk, but they can only do so if they're given alternatives to driving. Let me show you another health and equity indicator, and that's walkability. This is a website that's available for most urban places in the world that uses heat maps to show the relative walkability to local services and activities. And that's a terrific, it's a very useful tool for planning a community. You could say, we aspire to have a walk score of at least 70. Or you could say, here are some neighborhoods that have a low walk score. Let's see what we can do to improve them. We also know that how we plan our communities and where and our transportation policies have a huge impact on our pollution emissions. This graph shows daily vehicle miles and annual tons of pollution emitted in different types of neighborhoods. And we've done this type of research using many data sets and analysis approaches, and the results are very consistent. The walkable, compact urban neighborhoods have much lower emission rates than the sprawled automobile dependent areas. So that gets us thinking, what does it take to create a neighborhood, a community where people don't need to drive as much? And there are a number of very specific concepts. The latest being, we used to call it smart growth or new urbanism or transit-oriented development. Those are all great terms. One of the new ones is called the 15-minute neighborhood, implying that most of the things that people need are available within 15 minutes of where they live and work. I'll provide a website, a couple websites that provide good information on this. So this is a practical way you could say, to sell this or to share this information. And the research indicates many, many people who live in automobile dependent suburbs actually want to live in more walkable neighborhoods. There's a shortage of them. Here are some other tools that you can use to look at what we call transit score. It indicates the locations you can get to within a given time period by public transit. There's a lot of thinking going on about how to do this, how to create better, more walkable and transit-oriented and bikeable communities in suburban areas that were not built for it. And so we call it sprawl repair or urban villages. And there are ways that you can do this in most communities. I'll go through a fun little exercise here just to stimulate your thinking about this. This, I got to give credit to my good friend Dan Burden, who's a leader in the walkability movement. And he developed this set of slides, starting with your typical ugly, unwalkable suburban location. And the community decides, we want to change. We want to make this more compact, efficient, accessible. We want to make sure that it accommodates people who can't drive. So the community has to invest a few $1 million. Look at this. We put in a pedestrian bridge and sidewalks and traffic calming, so the traffic speeds are lower. So we put in so the city has to invest a few $1 million in basic multimodal infrastructure. And what happens is that area starts being attractive. It's a nice place to visit, to work, to live. So you start seeing development, and ideally you would guide that development so it's sufficiently compact and sufficiently affordable that a diverse range of people can live and work there. And you, of course, put in a lot of street trees, and it attracts more and more people, and over time it becomes beautiful. Now, I wanna make a point here. Compared with this, which creates the most value? Where, for example, will you have more jobs and more productive people and more tax revenue and more productive activity going on. Although we're starting from a concern about social equity and health, you could also argue this type of development also delivers economic value. So there's every reason you can create a partnership between environmental advocates, health advocates, affordability advocates, and the business community to create this type of community. So what's the barrier? Well, most North American cities greatly restrict the type of development that can occur, favoring either at one end, low density single family housing with big backyards and generous amounts of parking, and at the other extent, high rise. And we are missing the middle. Most communities make it very difficult for a developer to buy up a couple parcels that currently has single family housing and convert that to, let's say, a dozen townhouses or 20 apartment units, condominiums. An affordable, inclusive, accessible community allows that to be easy, that type of development. Here's a map showing Victoria's zoning codes. The yellow, which is the dominant amount of the developable land, only allows low density. It's called traditional residential. It only allows low density. There are good reasons that every community, virtually every attractive and economically successful city should be working to upzone to allow higher density development. This is some of the analysis that you could do where you can show the number of people per parcel of land. And by allowing upzoning, you can allow far, far more people, not just a little bit more people, but far, far more people in your community. If you are a pro-person planner, you see an increase in population density as a good thing. It means more people and more diverse people can be in our community. There's some great planning exercises going on now around the world. I happen to know a little bit about the city of Vancouver's climate emergency action plan. So they're using the climate emergency concern to organize their transportation and land use policy reforms to create more accessible, multimodal, and I would say more equitable and inclusive and healthy communities that are less oriented toward cars and more oriented toward people. So that was the quick overview of a whole bunch of complicated issues, and I hope that this can stimulate some discussion. I'll look forward to feedback and questions. Is that, Patricia, is that how we're gonna go?
Yes, we'll do both of the presentations, and then we are gathering questions in the Q&A, and we'll take them all up at...
Okay, so I will turn off my slideshow. And if anybody has any questions about what I presented, feel free to email me. I'll put my email address in the chat box later.
That's great. Thank you so much. And thank you for such a comprehensive presentation so efficiently. I was thinking as you were speaking at the end there about the challenges in changing the kind of housing that goes in, and here in Toronto and in other places, we sometimes face those challenges, even just putting sidewalks in, like the challenges of just that first step to build better communities.